The health center stood shining. The grounds were freshly swept, and the walls gleamed with new paint, a freshly painted beacon of hope in the heart of the village. Villagers gathered, clapping and cheering as the governor cut the ribbon. Beside him stood Senator Nboli, basking in the glory as cameras flashed. Today marks a new dawn for grassroots healthcare, the governor declared, his voice resonating through the crowd. The governor praised the project as evidence of Nboli's dedication to the people and a dividend of democracy. The senator reveled in the applause, knowing the photos would soon adorn the walls of his constituency office. His mind wandered, not to the villages, but to the political capital he would gain from this moment. Months later, Senator Nboli slumped into a chair at his opulent country mansion. A persistent cough and fever had drained him. "Why not visit the health center you built?" someone suggested. The senator laughed bitterly. "I'm a politician. I travel abroad for all my medical problems." He dismissed the idea with a wave, unaware of how hollow his grand speeches about grassroots healthcare now sounded. In the health center, Dr. Seb adjusted his stethoscope and prepared for the day's patients. Unlike other doctors, Seb had chosen to work in the village where he grew up. To him, every patient was family. "Dr. Seb," the matron said, "you remember the courtesy visit by the senator is today. We must line up and welcome him." Seb shook his head. "The people's adulation of politicians bewilders me. They are our servants, not our masters. Let's focus on our patients instead." As the senator arrived in his flowing white robe and beads, the matron was the sole welcoming committee. Her cheerful demeanor masked years of resilience. They walked briskly to her office, his personal assistant trailing behind like a shadow, burdened with a briefcase and an assortment of mobile phones. Chief Senator Nboli asked, "Where is the doctor?" "The yam that I have put on the fire to roast must be given the right flame to get a delicious outcome." "You are correct, sir," the matron replied, smiling broadly. "Dr. Seb is very busy with an ill patient right now. I am so sorry, sir, he could not be with us. True to God that Dr. Seb is very dedicated." "Dr. Seb," the senator said loudly for his entourage to hear, "is from England. I brought him here for my people." The staff whispered among themselves. Seb, they knew, was one of their own, a man with roots deep in the village, a stark contrast to the senator's disconnected pride. The matron's office had a welcoming simplicity. A nurse brought in light refreshments, greeting the senator with a respectful bow. The senator nodded as his eyes instinctively followed her retreating form. It is good to see a doctor who takes his work seriously. He arrives on time, treats the patients well, and only advise admission when absolutely necessary, the matron said. "Fantastic," the senator replied. "The trouble with our people is that they like pain. If the injection doesn't hurt, they think it won't work." The senator gazed out the window, where a long line of patients awaited their turn. Their faces bore a mix of hope and exhaustion, a stark reminder of their dependence on the facility. "There's still a queue of patients," said the matron, gesturing out the window. "Dr. Seb won't leave until he's seen them all." "Wonderful. I brought him back from abroad," Chief Senator Nboli replied. "This country needs more of such dedicated doctors, not those who are never on seat." The chief's voice boomed with pride as he recounted how Iguacha became the envy of neighboring villages with the health center. The inaugural ceremony had been a spectacle, a token of his leadership as he saw it. This health center is proof of what we can achieve. But why can't our politicians develop what is local for pride and prosperity? He didn't pause for self-reflection. His concerns were never truly about the people, but about ensuring their undying gratitude. He would now count on them to return him unopposed to the Senate.